I have to miss out on a lot of stuff, and then you just don't feel like yourself how you normally feel like.
Meet May. She's 9 years old and she loves doing 9-year-old stuff.
Yeah, I just like playing netball and horse riding.
But there's been something holding her back. May has cystic fibrosis.
So that's a huge impact in terms of her missing out on school, and then on a day-to-day basis she has to do regular nebulizers and physiotherapy and airway clearance, so it's a pretty relentless regime. She talks about it being happy or sad lungs, so that's how she sees things.
But thanks to a drug called Trikafta, there is hope. Described as a miracle drug, it works at lightning speed, improving lung function in just a week.
Her lung function is so low at the moment. It's 51%, which is the lowest it's ever been, which was a big shock and just made us feel even more desperate in wanting to access Trikafta.
Last year, Trikafta was added to the PBS by the federal government, but only for those 12 and over.
Not having access to Trikafta was just soul destroying, because knowing there's something there that could help her but we didn't have access to was a really frustrating time.
Now, after a year of campaigning, the government has announced that from May it will subsidise the drug for kids aged 6 to 11, reducing the cost from nearly $22,000 a month to just $30 per script.
Well, there will be about 500 kids, we think, between the age of 6 and 11 with cystic fibrosis and a particular mutation that gives them the opportunity to take this medicine.
The news, not only life-changing but life-lengthening for these kids.
It will also, we think, extend their life by decades. I mean, the average life expectancy of someone with cystic fibrosis right now is about 47.
CF affects every cell in the body, so it's going to have a dramatic effect. Most looking forward to the impact it's going to have on her lungs. But most importantly, just that day-to-day slog. It's like a constant uphill battle, so I'm hoping life will just become a little bit easier for the both of us.
So what's May looking forward to most about her new happy lungs?
2 reasons. We'll be able to run without stopping and getting a fishy. Maybe.
I know, I'm on the brink as well. Imagine having a little girl who's so sick, and what stands in the way of her getting well is $22,000, and then all of a sudden that becomes $30.
Yeah, I mean, I think they got her across the line because they rolled out May as the example, because she is the cutest kid I've ever seen in my entire life. They should have got some little shit and made it.
Did she end by saying she wants to chase a fishy?
Yeah,
Is it possible she is related to... Come on, guys, you know what I'm calling for. I mean, come on.
They're punishing you.
They just don't expect it from me. That's the problem.
This is why you'll never have this seat.
No, I can't. Some people can't feel that.
I've got it.
Yeah. So. By the way, for those at home, you may not know this. This is such a huge breakthrough that apparently 2 weeks ago, the Make-A-Wish Foundation announced that cystic fibrosis patients will no longer automatically get a wish. Now, that sounds like bad news, but the reason that's good news is it's because there's been such progress against the disease. It means that it's not life-threatening for so many people.
Yeah.
So now they just assess it on a case-by-case basis. That is an extraordinary development. And what a barometer to use, by the way.
Yeah, right.
Make-A-Wish Foundation. Anyway.